Welcome to the deep dive. We're cracking open a new stack of sources today.
Yep, got them right here.
Specifically, a couple of articles titled West Nile Virus Infection in Dogs and West Nile Virus in Canines.
Right.
Our mission to basically take these papers and, quickly get you informed about West Nile virus and our canine companions.
And it's interesting stuff.
Because right off the bat, let me tell you, these sources throw out some surprising facts that might just flip what you thought you knew about W&V in dogs.
That's absolutely right. I mean, if you've heard about West Nile in, say, horses or birds, the story these sources tell about dogs is, well, it's notably different in some key ways.
Okay.
We're going to dig into what these papers really highlight as the most important takeaways.
All right, let's jump straight in then. Unpack the absolute basics for us from this material.
Yeah.
What is West Nile virus infection in dogs, according to these articles?
Okay, so at its core, these sources describe it as a viral disease in dogs that ranges from an acute illness all the way to basically an inapparent infection.
Inapparent. Okay.
And that word inapparent is a big clue about where this is going. While it can sometimes involve neurologic symptoms, the really striking finding is how often it just doesn't. The culprit is the West Nile virus itself, a member of the Flaviviridae family.
Right, the Flaviviridae. And how widespread is this virus based on what the papers say? Is it everywhere or?
It's pretty extensive, geographically speaking, according to these articles. They place it across North, Central, and South America,
Okay.
plus Africa, Asia, Southern Europe, and even Australia, where, interestingly, they mentioned it's actually known as Kunjun virus.
Kunjun virus, huh?
Yeah.
So definitely not just a local issue.
Not at all.
Okay, so how do dogs actually pick it up? Is it like the same way people get it?
Exactly. The primary way dogs get infected, as described in these sources, is through the bite of an infected mosquito. Simple as that, really.
Right.
Though the specific mosquito species involved can vary depending on where you are geographically.
Makes sense.
But here's a really interesting detail they highlight about the infection in dogs. It generally produces a low-level presence of the virus in the blood. That's called viremia.
Low-level viremia. And why does that low level matter? What's the significance?
Well, it's a crucial point these sources emphasize. They note that this low viremia is typically undetectable by about day 6 after infection.
Okay, gone quickly.
Yeah. And more importantly, the level is usually insufficient for a mosquito that bites that dog to pick up enough virus to then become infected itself and spread it further.
Ah, okay. So dogs aren't really amplifying hosts in the same way some other animals might be, like birds or horses.
Correct. The papers are pretty clear that dogs don't usually contribute to the transmission cycle in that significant way.
Gotcha.
And on a related note, they mention that antibodies, the immune system has seen the virus, generally become detectable around day 7 after infection.
Okay, so we know it's a mosquito-borne virus, found lots of places. Dogs get low viremia. Who's susceptible? And what does it actually look like in a dog? Because this is where the sources got particularly interesting for me.
Yeah, this is key. So these articles say that natural infections aren't really limited by species or age when it comes to susceptibility. Any dog could potentially be exposed.
Okay.
And when you look at exposure rates across different areas, which they measure by checking for antibodies, that's seroprevalence. The papers cite a really wide range.
How wide?
Anywhere from 3% up to 38%, depending on the specific geographic region.
Wow, 38% in some places.
Yeah, so that tells us that a fair number of dogs in certain places are definitely getting exposed to the virus.
And here's the twist, right? The big takeaway that just jumps out from reading these sources. Exposure doesn't seem to equal obvious illness, does it?
Absolutely not. This is perhaps the most surprising finding the articles highlight. They explicitly state that a very high percentage of dogs show no clinical signs at all. 0. None. They even mention that in experimental infections where dogs were deliberately infected in a lab setting, those dogs didn't show clinical signs either.
That's incredible. So while exposure might be pretty common depending on where you live,
Right.
the actual disease you'd notice is rare.
Exactly. Very rare.
Wow. So you could have a dog who's encountered West Nile virus, mounted an immune response, and you'd likely never even know it.
Precisely.
But okay, for those, those rare instances where symptoms do appear, what kind of things are we talking about based on these sources?
Right, the unlucky few. So the sources indicate that if signs do occur, it's typically after an incubation period of about 2 to 4 days.
Okay.
A fever can happen, potentially quite high. They mention ranges like 40.3 to 42.2 Celsius, which is 104 to 108 Fahrenheit.
That's a serious fever.
It is, and that usually shows up around 3 to 6 days post-infection.
Yeah.
And in those uncommon cases where dogs are clinically affected, the papers list a range of signs, often neurologic.
Neurologic, okay. Like,
Things like ataxia, that's incoordination, sort of stumbling, also depression, loss of appetite, tremors, difficulty with conscious proprioception.
that's knowing where their feet are, right?
Exactly. Knowing where their limbs are in space. Also seizures, general weakness, and even flaccid paralysis in some cases.
That's a scary list, even if it only happens rarely. So if a dog does show these neurologic signs, what do the sources actually say is causing them? And are there factors that make a dog more likely to get infected in the first place?
Well, the sources directly attribute that neurologic disease to the West Nile virus itself. No ambiguity there.
Okay.
And when it comes to risk factors, the papers point pretty strongly to lifestyle playing a significant role.
How so?
They found that dogs who spend a lot of time outdoors have much, much greater odds of testing positive for exposure being seropositive compared to dogs that are primarily indoors.
Yeah, that makes intuitive sense. More time outside, more chance of mosquito bites.
Exactly. They even mention high seroprevalence in wild coyotes as sort of supporting evidence for this outdoor risk factor.
Ah, interesting. What else do they flag as increasing risk?
Stray dogs also had higher odds of being seropositive than owned dogs.
Which, again, probably links back to time spent outdoors and just general exposure levels, right?
Most likely, yes. The articles also mentioned something interesting. The specific lineage of the virus can matter.
Oh.
Yeah, lineage 1 virus, which they say includes all North American isolates, seems to be more neurovirulent, meaning more likely to cause neurologic issues than lineage 2, which is found more in Africa.
Huh. So not all WNV is created equal virulence-wise.
Apparently not. And then, perhaps, obviously, they connect the yearly ups and downs in infection rates directly to how dense the mosquito populations are in a given year or season.
Right, more mosquitoes, more transmission potential. Okay, so given that most dogs show no signs, and the signs that do appear could look like, well, a lot of other things, how do veterinarians even go about diagnosing WNV in a dog, according to these sources? This sounds tricky.
It absolutely is tricky, and the sources really emphasize this point. The neurologic signs they link to WNV are described as essentially indistinguishable from those caused by a whole bunch of other viruses spread by arthropods. Things like Eastern equine encephalitis, Venezuelan equine encephalitis, lacrosse virus.
So a vet seeing those signs wouldn't immediately think West Nile. They'd have a whole list of possibilities.
Exactly, a long list. The papers mention other crucial differential diagnoses to rule out, including rabies, canine distemper,
Oh, wow.
neosporosis, toxoplasmosis, pseudorabies, and even encephalomyocarditis virus. Big list.
Yeah. So standard blood tests, do they help narrow it down?
Generally not, according to these sources. Routine tests like a CBC or biochemistry panel are usually normal. One paper mentions you might see a temporary drop in white blood cells if you do serial sampling, but even that could stay within normal reference ranges.
Not very helpful then.
Not definitive, no. They also list using tools like an electroencephalogram and EEG, which measures brain electrical activity.
Okay. What about tests specifically designed to find the West Nile virus itself?
Well, here's the catch again. Finding the actual virus in the blood during the acute phase, when the dog might first seem sick, noted as highly unlikely in dogs.
Because of that low viremia we talked about earlier.
Precisely. Because the virus level in the blood is so low and transient, if you were to try and detect the virus directly, the sources say the test of choice is RT-PCR, looking for the virus's genetic material, either specific for WNV or maybe a broader panel for arboviruses.
Okay, so direct detection is tough. What's more useful then?
Looking for the dog's immune response, the antibodies. That's highlighted in the papers as a more practical approach. They recommend testing paired serum samples, one taken early in the illness, acute, and another taken later, convalescent.
And what tests do they run on those samples?
Usually IgM ELISA and virus neutralization assays. Those can show if the antibody levels are rising, indicating a recent infection.
Right. And what about if, sadly, a dog doesn't make it? Postmortem testing.
Yes, for samples taken after death, the methods mentioned are, again, RT-PCR, or doing immunohistochemistry on tissues, like the brain, to look for viral proteins or genetic material.
And if they examine those tissues postmortem, what do these sources say they typically find? Any obvious damage?
Generally not, according to the papers. They mention that visible, gross lesions are usually absent in the admittedly limited number of dogs that have been necropsied.
Limited number. Okay.
Though they do cite one specific case that showed inflammation of the heart lining, epicarditis.
Interesting. What about under the microscope? In the brain.
Yes. Histologically, the brain lesions, when present, are described as mild, multifocal, non-suppurative meningoencephalitis.
Okay, breaking that down.
Basically, mild inflammation around blood vessels in multiple spots, mostly in the gray matter of the brain, involving specific types of immune cells like lymphocytes and histiocytes, but again, often described as mild.
So diagnosis is complex. Now, if a dog is one of the rare few showing severe signs and maybe they manage to get a diagnosis, what does this material say can actually be done for them? Is there a treatment?
The sources are quite clear on this. Treatment is purely supportive therapy.
Supportive, meaning that
It's focused entirely on managing and reducing those neurologic signs and keeping the dog stable. There's no specific cure mentioned that targets the virus itself.
do they mention any specific medications used in supportive care?
Yes. They explicitly note that antiviral drugs haven't actually been tested for efficacy in dogs with WNV, so we don't know if they'd work.
Right.
But they do mention using medications to reduce fever and antipyretics, and potentially anti-seizure medications if the dog is having seizures, basically managing the symptoms.
Got it. Okay, what about preventing infection altogether? That seems like the best approach if possible. Is there a vaccine available for dogs, like the one commonly used for horses?
That's another really key point the sources address directly, and the answer they give is no.
No vaccine for dogs.
Correct. While vaccines are available and widely used for horses, the papers explicitly state they have not been approved for use in dogs.
So prevention really just boils down to avoiding mosquito bites then?
Pretty much. The sources don't delve into super specific methods for dogs, beyond strongly implying that reducing outdoor exposure, especially during peak mosquito times, is beneficial, given that outdoor exposure is the main risk factor they identified.
Okay, wow. We've really peeled back the layers on West Nile virus in dogs using these particular sources. And the picture they paint is, well, it's quite different from what some people might expect, I think.
Absolutely. I think the key insights these specific articles provide are, one, exposure seems potentially common in many areas, judging by antibody levels.
Right, that's seroprevalence data.
But two, actual clinical illness is rare, very rare. Three, when illness does occur, it's often neurologic and looks like a lot of other diseases, making it hard to spot.
And hard to diagnose.
Exactly. Four, diagnosing it definitively in live dogs is challenging because of those low viral loads and the nonspecific signs. And five, maybe most importantly for owners, there isn't an approved vaccine for dogs mentioned in this material.
Right. Our mission here was to dig into these sources, unpack them, and get you informed quickly, highlighting what really stands out. And I think we've definitely seen that the story of WNV in dogs, at least according to these papers, is much less about widespread severe disease and far more about frequent, often silent exposure.
Correct. The vast majority of infected dogs described in these sources are those inapparent cases. They get infected, fight it off, and nobody's the wiser.
So here's the thought these sources kind of leave us with to mull over,
Yep.
Given how common exposure appears to be based on that really wide range of seroprevalence data, sometimes quite high, but how incredibly rare severe illness is described in dogs. What does this fundamental difference between exposure and actual disease tell you about? Maybe the virus itself in dogs, or perhaps how the canine immune system typically handles it. Or maybe what specific rare factors might be at play when those few severe cases do happen. What further questions does this deep dive raise for you about WNV in our dogs?